Hello, Mr. Bear. My name is Trisha with Respiratory Care, and I'm here to give you some medications that the doctor has ordered. The doctor would like you to start using some what we call bronchodilators. Those target the bronchi in the lungs. They dilate them, opening them up, making it a little bit easier for you to breathe. Sounds like you've been having some little bit of shortness of breath and maybe some wheezing going on at times. So this targets the lungs to relax the smooth muscle, and it makes that breathing easier. And reduces or eliminates that wheezing for you. So first we're going to get some vital signs. We always take a listen to your lung sounds, look at your heart rate, get your oxygen level in your blood prior to starting. We'll get those before and after the treatment, and we'll see how those things go. So first I'm going to take a listen to your vital signs here, or get those lung sounds. Take a deep breath in for me. Good. Very good. And I'll listen to the front side. Good. Very good. Hearing a little bit of wheezing going on in there, so this medication will hopefully help with that. First, can I get your name and your date of birth? Very good. So the first one we're starting with, this one is called Xopenex, and this is a short-acting inhalant medication. This will go right into those lungs to open up those airways for you. We just connect this to the oxygen source. Liquid medication we put into our little cup here, and then we'll breathe this in once it starts going. We'll have you take a tight seal of this around your mouth, and then you're going to breathe normally with taking occasional deep breaths for me. Alright, this one takes about 10 minutes or so to complete. Very good. I'll have you take a big deep breath in and cough for me. Very good. And you get that medication down deep into those lungs. This one, we're going to see your main duration of it is going to be about 5 to 8 hours. So we're going to do this one 4 times a day. So the doctor's ordered that 4 times a day, so approximately every 6 hours we'll complete that one. So sounds like it looks like you're breathing a little bit easier too. Let's take a listen to your lung sounds. Good. Like those big breaths. Very good. Good. You did improve that wheezing. I'm going to listen to your heart rate again. And then that oxygen level in your blood. And that's improved. That just means we're getting that oxygenation through those lungs that we need to. So like I said, that was your Xopenex. That was the short acting. The next one that we're going to have you do is more long acting. It's going to maintain or help keep those airways open a little bit longer. This one's going to last for about 24 hours. This one is what we call a dry powder inhaler. This one is Incruse. Ellipta was on the name of this outer portion here, and as you can see there's numbers. This will track how many ones you've done, so you know when you need to reorder it once you're finished with it. So with this one, we activate it by just simply opening the cap, and you hear that click. So this has dry powder on the inside. What you'll do is you'll seal your mouth around the mouthpiece here and take a big breath in. That'll get all that powder medication down into those lungs to open those airways. So before we put it around your mouth, I want you to blow all the air out that you can of your lungs. Then once we take a big deep breath in with this sealed around your mouth, we'll hold your breath for 10 seconds, and before breathing out, you move it away from your mouth there, because we don't want your air to get back into the inhaler. We just want you to breathe it in so that it pulls that medication up and out of that inhaler. So big breath out to get all that air out of your lungs. Tight seal around, take a big deep breath in, hold it for 10 seconds, breathe out. Okay, very good. And then just simply put that back over the top like that. Like I said, this one lasts for about 24 hours, so we want to do this one once a day, and we want to try and keep it at the same time so that you keep that medication built up in your system. So like I said, that's Xopenex, that's the short acting. We're going to do that about 4 times a day. This Incruse, we're going to do that just once a day. Try and do it on the same time each day that you do it. So with this short acting, we could have some side effects. Sometimes it can increase the heart rate a little bit. With this Xopenex, typically not so much. Can give you a little bit of tremors. So either of those, if those get bothersome, if they get worse after each treatment, be sure and report that. But sometimes that can be a little bit normal, so if it happens within 30 minutes of the treatment, that's okay. But like I said, if it's bothersome, we want you to report it. With the dry powder inhaler, sometimes that can cause a cough or a dry mouth. Unfortunately, again, they can be common symptoms. However, if they get too bothersome, just let us know. We can maybe do some changing of your medication. And take another listen to your lungs after having that dry powder inhaler. Take a deep breath in. Very good. Good. Get that heart rate again. And get that oxygen level. Very good. They've all improved. So, do you have any questions for me? Is there anything I can get you before I step out of the room? All right, we will see you again in approximately 6 hours to do just that inhaled breathing treatment, the one that we use the mouthpiece for, that was connected to the oxygen source. That one we'll do, like I said, every 6 hours. So, thank you, Mr. Bear.